Welcome to First Response Training Group's YouTube page. Today we're going to be talking about the use of epinephrine. My name is Thomas Blum. I'm the program coordinator as well as lead paramedic instructor here at First Response. Alright, so now we're going to be making our 1 to 100,000 epi, or our push pressure epi. We have our crash cart epi, so 1 to 10,000. We have our 3-way stopcock, and we have a 10 cc normal saline flush. Okay. So the first thing we're going to do is we're going to attach our 3-way stopcock to our normal saline flush. And we're going to push out 1 ml. Okay, so now you'll see I'll have 9 mLs in my saline flush. Next thing I'm going to do is I have my crash cart epi, set it all up. And I'm going to attach my crash cart epi to my 3-way stopcock. Now if you look at our 3-way stopcock, there still is an empty valve. So essentially all we're going to do is we're just going to push the off switch to ensure that no fluid comes out that unoccupied spot. Now what we're going to do is I'm going to be looking at my crash cart epi, looking at my 10 cc flush, and I'm going to push 1 ml of my 1 to 10,000 crash cart epi into my 10 cc flush. So now you can see I have 10 mLs back in my normal saline flush. So let's talk about essentially what we did. So in our crash cart epi, we have 1 milligram of 1 to 10,000, okay, in a 10 cc flush. So essentially we have 100 micrograms of epinephrine per 1 ml. All we did by using the 3-way stopcock is by pushing 1 ml out of our crash cart epi into our 10 cc flush, we've moved 100 micrograms out of our crash cart epi into our 10 cc flush. So now what we have is 100 micrograms in 10 mLs. So our concentration is 10 micrograms per 1 ml. Our dose for epinephrine when treating hypotension or bradycardia is 2 to 10 micrograms per minute. So essentially what we're going to do is we have our patient, right? We're attaching to our lock, and we're going to push 1 ml every 60 seconds. So essentially we're pushing 10 mics a minute. No different than if we put our epi into our saline bag, used the dial flow, and titrated it to our drip rate, which would obtain 10 mics per minute. The biggest benefit to this is essentially within 60 seconds I can get 10 micrograms per minute into my patient. The con is you're going to get that roller coaster effect, meaning the blood pressure is going to come up, and if you're not on top of it, where essentially every 60 seconds you're administering another 10 mics, the blood pressure is going to begin to drop down. But when you administer the 10 mics, the highest dose within that range, you should get a good alpha-1 agonist effect, so the blood pressure should come up, which gives you time to make your EPI infusion. Okay, so then our next segment we're going to talk about is the transition from push pressure EPI to an EPI infusion, and the possible ways you can make your EPI infusion, and consider some easy math to do it in the back of the truck. Okay, so we've utilized our push pressure EPI, right? We still have 100 mics in our 10 ml flush, so essentially we're still pushing 10 mics per minute to keep that blood pressure up. But to prevent that roller coaster of a blood pressure, we're going to transition into an actual infusion, because we want to titrate to the exact amount of epi per mic per minute to obtain a good blood pressure. So you can make epi infusions however you would like. The most important thing is you understand how much epi you've put into your normal saline bag, right? The concentration that you've created or obtained, and the drip set that you're using, and the appropriate amount of drips per minute to yield your desired dose. Once again, our desired dose here is 2 to 10 mics per minute. So here I have a 500 cc bag of normal saline. I've opened up another crash cart epi. So once again, I have 1 milligram of 1 to 10,000 in 10 mLs. Okay. You can also utilize your 1 to 1,000 epi. If you were using your 1 to 1,000 epi, you would just drop 1 ml, so you drop 1 milligram of 1 to 1,000 epi. If all you have access to is your crash cart epi, you can use that as well. It's just a little bit more diluted because you have 10 mLs versus 1 ml. So I'm going to transition my 1 milligram of epinephrine, 1 to 10,000, into my 500 cc bag. okay? When you make that transition, when you infuse this, or when you mix this epi into this bag, you've now mixed 1 milligram of epi into 500 cc's, okay? So you've mixed 1,000 micrograms of epi into 500 cc's. So your concentration now is 2 micrograms per 1 cc. Your next consideration is, okay, my desired dose is 2 to 10 mics per minute. Which size drip set should I use that gives me the easiest math and allows me to administer the appropriate drips per minute? So essentially what I mean is, if you've made this so diluted, okay, to give 10 mics a minute, you may require a lot of drips per minute. If you get above 120, 160 drops per minute, that's essentially wide open. It's impossible for you to appropriately titrate it. So the concentration that I've created, I'm going to utilize a 10 drop set. 10 drops is your macro drip set, so for every 10 drops equals 1 ml. With the concentration that we've created, 1,000 micrograms into a 500 cc bag, 2 mics per 1 ml, so for every 10 drops we get 2 mics, okay? So if I administer 10 drops a minute, I'm administering 2 mics per minute, okay? If I wanted to administer 4 mics per minute, I would titrate up to 20 drops per minute, and so on and so forth. So when utilizing an EPI infusion, okay, depending on what your patient's blood pressure is, will kind of dictate where you start your infusion. If it's a little bit on the lower end, you may start up in the middle or the high end of your dose range, so 5 mics per minute or possibly 10 mics per minute, and begin to titrate down. If you decide to start on the lower end of your infusion, so for this being 2 mics per cc and you want to administer 2 mics per minute, you start off at 10 drops per minute. Depending on how your vital signs are trending, you may at that point titrate up to 4, 6, 8, or 10, or if you start on the higher end, you may titrate down to 6, 4, or 2 mics per minute. But the biggest advantage to these infusions is you can find that sweet spot. You can find that blood pressure that was yielded by 2, 4, 6, 8, or 10 mics per minute, and you can continue to infuse at that rate so your patient sustains that blood pressure and doesn't get that roller coaster of vital signs. So essentially, we talked about the creation of using 1 to 1,000 to 1 to 10,000, especially if you're in an epi shortage. Taking 1 to 10,000 and creating 1 to 100,000 for push pressure epi. And then after we've utilized push pressure epi, creating an epi infusion to maintain a good blood pressure that allows for adequate perfusion. On behalf of myself and First Responder Wrangler, I just want to thank you for watching our video on the use of epinephrine. Please subscribe to our link below and keep an eye out for additional educational videos.